At Pabau, we are always looking for ways to improve our videos. Please like, comment, and subscribe to stay in the loop with new content. Hi, I'm Ivana, one of the senior medical content writers here at Pabau. A skin consultation treatment form is a clinical document used to record essential information gathered during a skin assessment before any treatment is carried out. It exists to provide a clear, consistent way to capture patient details, skin concerns, medical history, and treatment objectives. This ensures that every consultation follows a structured approach and that important clinical information is not overlooked. This form is important because skin treatments depend heavily on accurate assessment and documentation. Skin health can be influenced by medications, allergies, hormonal factors, sun exposure, and underlying medical conditions. Recording this information helps clinicians make informed treatment decisions, reduces the risk of adverse outcomes, and supports patient safety. It also creates a reliable clinical record that can be reviewed over time to monitor progress and guide future care. In everyday practice, the skin consultation treatment form is usually completed during an initial appointment and updated as needed at follow-up visits. The clinician discusses the patient's concerns, examines the skin, and documents findings such as skin type, condition, and areas of concern. Proposed treatments, expected outcomes, and potential risks are recorded to ensure clarity and shared understanding before proceeding. When using this form, accuracy and clarity are essential. Information should be recorded objectively, and any contraindications must be clearly identified before treatment begins. Consent discussions should be fully documented, and aftercare advice should be specific and easy to understand. Where appropriate, and with consent, clinical photographs should be taken to support assessment, track changes, and maintain an objective visual record. Step 1 is to start by confirming the patient's personal details and discussing their main skin concerns, medical history, and lifestyle factors that may affect skin health. Step 2 is to carry out a detailed skin assessment, documenting skin type, current condition, and any risks or contraindications, and taking photographs if required. Step 3 is to explain and record the recommended treatment plan, including benefits, risks, and alternatives, ensuring the patient has the opportunity to ask questions. Step 4 is to complete the form by documenting consent, aftercare instructions, and plans for review or follow-up. In summary, a properly completed skin consultation treatment form supports safe, consistent, and effective skincare by guiding assessment, decision-making, and documentation from the first consultation. Visit our website where we have over 6,000 free templates and resources to choose from.